The question was, why does heat seem to work so well for many types of musculoskeletal related pain? The old way of dealing with anything that was inflamed, bruised, or was always ice, right? Which is rest, ice, compression, elevation. Can you describe what is happening here? And I will in a very neuroscience way in just a second, but I wanted to get your take on using heat versus ice, and whether you have any stories, tales, whatever it is.
Well, I mean, I can sum it up easy. Basically, heat is just going to send a lot more blood to the area, and it's going to bring more nutrients to the area and loosen up maybe muscle spasms and tight muscles, and that's going to make you feel better, especially make you able to get up and move around more and get through the rehab. That's kind of what works there in a roundabout, condensed way. I'm sure you'll be able to.
Yeah, that's like heat causes vasodilate, like the very, biomechanical way. We get increased blood flow, like you said, and especially to Golgi tendon organ activation, which is really important in muscles for how tight a muscle will be. That starts, the activation of that is why the muscles kind of relax and get out of spasm.
Perfect.
So if you put a heat pack on your tendon, you'll feel your muscle will relax.
Right.
Which is kind of fun.
Right. Yeah. You said it a lot better than I did. Now ice.
Yeah.
Ice can work.
Ice is an interesting one, isn't it?
Ice can work. It just depends on what is going on. Now, ice can work if you have more of a neuropathy type pain. If your pain is more nerve, it'll calm the nerves down. But if it's kind of if the nerve pain is causing your muscles to spasm, you're going to want to go ice and then heat right after.
Yeah.
So it's kind of like you're calming the nerves down, telling them to stop putting your muscles in spasm, and then you're going to tell the heat to stop the spasm, right? Because our bodies and brains are really smart and really stupid at the same time, because it puts us in a cast, the spasm, to say, hey, don't move, you're hurt. We don't want to get any more hurt than we already are. But it's the spasm that's causing the most amount of pain.
Yes. So we need to need to deal with that as well.
Right. So you got to get out of the spasm. So you got to move. You got to kind of work. A term a lot of people like to use, including myself, is you got to burn the spasm out. You got to send a ton of blood into that spasm in order to get it to loosen up and tell the nerve signals to say, hey, listen, we're not as hurt as you think. Loosen up so that I can keep moving. And at least that's how it's worked for me. That's how it's worked for a lot of people. And that's how it's worked at least in the text that I've read. So going back to the heat versus ice, the person that actually wrote the little thing, RICE, RICE, rest, ice,
compression, elevation,
elevate. He even came out later on and said, I was wrong. It doesn't work.
Yeah.